Good evening and good afternoon, and welcome to our webinar, TAA Educational Resources and Support Services. My name is Angela Sullivan, Medical Project Specialist at the Tourette Association of America, and I will be your moderator as well as presenter for this afternoon. This webinar is being provided as part of the Tourette Health and Education Program, a program of the Tourette Association of America in partnership with the CDC. During this afternoon's webinar, we would be very happy to hear from you and include your voice in the conversation. You may ask questions or share comments using the question panel on the right side of your GoToWebinar player at any time. We will collect your questions and address them during the Q&A session at the end of the presentation. I would like to mention that the funding for this webinar was made possible by our cooperative agreement with the U.S. Centers for Disease Control and Prevention. The views expressed by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. So we're going to start off today. My name's Angela, like I mentioned, and I'm going to be giving the webinar this afternoon, a little different than what we usually do, but please, as I mentioned, ask questions throughout the webinar. I'd be happy to answer them at the end, and thank you all for joining us. So this afternoon, I wanted to just say thank you again for taking the time to join us on this webinar. We wanted to go over in detail all the wonderful resources that we have to help the members of our community navigate life with Tourette syndrome. So today, here's a brief rundown of what we're going to talk about for the next 20 to 30 minutes. I'm going to give you a very brief overview and go over more about what the Tourette Health and Education Program is. And I'm going to introduce you to our TAA-CDC team so you guys have a better understanding of who's behind all of these resources and who is here really to help you. We're going to go over some of the resources in detail that we have for you. And I also wanted to take the time to talk more about our programs, whether they're in person, our online support groups, webinars such as this one, and then our Youth Ambassador program and what opportunities we have for our youth. And then like I said, we're going to take some time to answer some questions that you guys may have. So very brief, we are currently in our 15th year of partnership or cooperative agreement with the CDC. The TAA has served as the National Public Health Practice and Resource Center for Children with Tourette Syndrome for about 15 years now. The overarching goals of this program are to provide information, consultation, and referral programs as a channel to respond to questions and provide information. We develop health communication programs and materials, which is what I'm going to go over for the majority of this webinar. And we also offer education and training programs. Unfortunately, our funding is restricted to certain efforts. For example, we can't use the money for programming for adults at this time, as the grant is specifically for children. However, the TAA is spending some time in creating an adult task force so we can start providing resources and information for adults further down the line. So I wanted to introduce you guys to the TAA-CDC team. As I mentioned, my name is Angela Sullivan. I'm the Medical Project Specialist here at the Tourette Association. I've been here since March of 2018. Right now, I oversee our medical and CBIT in-person presentations, which you will hear about later on. I oversee our webinar series, so you'll often hear my voice if you guys tune into webinars monthly. I also manage our exhibits, and this is where we are able to distribute all of our resources to the community, whether they are providers, educators, or potential parents of children with Tourette syndrome. So Chelsea Tolner is the Director of Outreach and Education. She joined the TAA back in June of 2017, and she oversees all of the major and larger projects that the cooperative agreement pays for. Natalie Joseph Pauline, who you may be familiar with, She oversees the education and family community in-person programs, which I will also talk about a little later on. She manages the small grants program. We provide some small funding for our chapters and Center of Excellences to give in-person trainings and community programming for their community. And she also oversees the Facebook Lives, which I will talk about also. And lastly, she oversees and manages the Youth Ambassador programs, which I will also be talking about later on in the webinar. So this is where I'm going to spend the bulk of the time talking about our resource development. We have quite a few in-print materials that are available to you, both on our website and, like I said, in print. So we have a What is Tourette Syndrome brochure. We have a brochure that focuses just on comprehensive behavioral intervention for tics, also known as CBIT. We have about 6 toolkits, one specifically for patients, providers, educators, law enforcement, children, and young adults. And then we also have a comic book series, which is named Exploring Life with Tourette. So our What is Tourette Syndrome brochure is an excellent overview of what Tourette syndrome is, talks about symptoms, the causes of Tourette syndrome, how one could be diagnosed, different treatment options, and of course it spends a good amount of time explaining what the co-occurring conditions that go along with Tourette syndrome may be. This is very helpful to share with your child's school, general community members, anywhere that you think is appropriate for people to know about Tourette syndrome, whether you are a provider or a parent of a child who has Tourette. This is a great resource to give people so that they have a better understanding of what Tourette syndrome is. Our next brochure, which is this one on CBIT, this is mostly and only focused on what that treatment option is and where you can get it, and kind of an overview of what that looks like. I'm going to go into more detail about the toolkits next. However, I wanted to just mention that the comic book series are a more relaxed way to have a discussion with your child about handling their Tourette in certain settings. So we have one that is for the at home, at school, and at the mall. So you can have a nice sit down with your child about what a social situation in this setting might look like and how you can explain it to them and how they could overcome a fear maybe of them being in this atmosphere. So the first toolkit I'm going to go over is a patient's guide to diagnosis, treatment, and support. So within this toolkit, you will find topics on getting diagnosed and receiving treatment, preparing for a doctor's visit, which is very important if you either have been newly diagnosed or are visiting a new doctor. This could be a nice section for you to see what important things you could focus on when visiting a new doctor. It will, of course, go over common co-occurring conditions that are often going along with a child's Tourette syndrome, bullying prevention, which is extremely important to talk to your children about, addressing education needs and Tourette syndrome in the classroom. And we have also provided within this toolkit a piece of paper that can come out so you can utilize. It's a sample letter to schools requesting specific accommodations. We have also included in there some common frequently asked questions and answers, so you can see what other patients and families might be asking the Tourette Association and how we can respond to that and how we can help you. So this toolkit is an excellent resource. It's mostly useful for patients and families, whether you have been recently diagnosed, like I mentioned, or are just looking for more information about any of the topics that I listed on here. They are great to share with your providers so that they can also give them to other patients and families. We, like I said before, we attend a lot of exhibits and we share this resource with people so that they can leave them in their waiting rooms and they can provide it out to their patients and families. Okay, the next resource I'm going to go over is the Care Provider's Guide to Diagnosis, Treatment, and Support. Also similar to the Patient's Guide, when we travel to exhibits, we bring this resource specifically when we're going to somewhere we're going to see a lot of pediatricians, neurologists, anyone who may come in contact with a patient with Tourette syndrome. So within this toolkit, you'll see topics such as providing an accurate diagnosis, the prevalence of Tourette syndrome and tic disorders, what that looks like, and what providers may come across. Common co-occurring conditions, so that providers can also see what these conditions may be, and these might be what patients are coming to you providers to specifically talk about, so they can get a better understanding of what these things may look like. Of course, treating Tourette syndrome and other tic disorders, it's broken down into CBIT, so it'll go into a little more detail about how a provider can utilize CBIT and what that looks like from their end. And of course, medications, things that we have heard that work in the past and what the recommendations currently are. Also within this toolkit, you'll see a section on addressing a patient's educational needs, because we know that educators as well as providers should work together when they have a patient with Tourette syndrome, so that everyone is on the same page and the child can get as much support as possible from both their provider and educator. So as I mentioned before, like in the patient's guide, there is a sample letter that you can actually remove from the toolkit. It's a sample doctor's letter from a parent to their child's school regarding a recent diagnosis of Tourette syndrome and asking the school to support them and how they could go about doing that during this time. So next, we're going to talk about the Educator's Guide to Planning and Support. We bring this toolkit to a lot of our exhibits as well, whose attendees are mostly educators and support school staff. This is a great resource for them, and we've heard a lot of great feedback about it, that it's just been really helpful, especially for parents to go into a school and be able to provide this resource for their child's teacher. So, as I mentioned before, what you can find within this resource is how educators can react to Tourette syndrome and tics in the classroom, some tips and tricks for them, identifying common education difficulties with Tourette syndrome, what a 504 plan and individual education program is. I know that is a common question that we get, distinguishing the difference between the two. So within this toolkit, you will find plenty of information on that. There is supplemental information on our website. So if this is something that you need more information on, there is a lot for you on there. Next, there is a nice section on the role of school professionals and support staff. Here's just a short list of the occupations in there that we focus on, whether it's school administration, teachers, school psychologists, school nurses, occupational therapists, whether they're in the school or if you're seeing an occupational therapist outside of your child's school, how speech language pathologists can support somebody with Tourette syndrome, and a few more. So there also is a handout within this toolkit, a sample letter from school informing parents about a student in their classroom with a Tourette syndrome diagnosis and their symptoms. So this is great for you to provide to the school, because there is this resource in there. So if a teacher needs to let the rest of their child's class know that their child has Tourette syndrome, this is a great way for them to do that. Okay, so I will go back. All of this webinar will be posted on a YouTube channel. Once it has been recorded and downloaded. So you should see that up on our YouTube at least by tomorrow. If you would like me to send you the link to that separately, I'm more than happy to do so. I can also provide you with the slide deck. I did have some links in there, so that will be available. If you would like that, please feel free to email me afterwards. You'll see my email address at the end. Okay, so moving on, now we're going to give you a little bit more information about our training for law enforcement toolkit. This is one of our newly produced toolkits within the past year or two. It's an excellent resource for people to share out within the law enforcement community. So some of the topics you may see in here are understanding Tourette syndrome and tic disorders, the basics. So this gives a great overview of what Tourette syndrome is, the most important information that someone in law enforcement should know if they were to come across somebody with Tourette syndrome. So we also talk about some tic challenges in social situations, considerations for law enforcement, de-escalation techniques, and then some high-risk encounters, just so that law enforcement can be aware of what type of situation may arise when they are coming across somebody that has Tourette syndrome. So as I mentioned, this is really helpful to give to school resource officers and other law enforcement support staff. In this toolkit, there also is a pull-out card for law enforcement on what Tourette syndrome is, and then on the back, there are the de-escalation techniques that are listed inside the toolkit. It's actually on the back of the card. So somebody in law enforcement can pull that out of the toolkit and carry it around with them. So they have this resource on them at all times. So right now in the back of the toolkit, you'll also see that we do provide training for law enforcement. We are working on setting this up and having that available. We do, like I will talk about in a little while, do general in-person presentations about what Tourette syndrome is. So if you are in law enforcement or know of a law enforcement community that is in need of a presentation on Tourette syndrome, we're more than happy to work with you, and we can talk about all the things that are inside this toolkit, as well as information on general Tourette syndrome knowledge. So the next toolkit I have here is the Children's Guide to Tourette Syndrome. This toolkit is appropriate for kindergarten and elementary school students who have Tourette syndrome. It is also helpful to share with a classroom of children who has a child in there with Tourette syndrome. So this is a really great resource for not only someone who is living with Tourette in their daily life, but also for a child to understand more about what their classmate may be going through. So within this toolkit, you'll see what Tourette syndrome is, different types of tics, what else should the child know when having Tourette syndrome, how a child will know if they actually have Tourette syndrome, and how they may have got Tourette syndrome. So this is all very kid-friendly. And the fun part, we have a fun removable activity page with coloring and some activities for young kids to learn about Tourette syndrome. So this is, like I said, a great resource for in a classroom, but it's also a great resource for providers to have to give out to parents and families of their patients. We also have a toolkit for young adults. So this is more appropriate for high school students and even into their early 20s. So within this toolkit, you'll see some more information about the basics of Tourette syndrome, common co-occurring conditions a young adult may be dealing with, some treatment options, whether it's CBIT or medication, some things that have been recommended to them, some more information about knowing your rights. Tourette syndrome is covered under the ADA, so this information will just give you some good detail about what that means. So there's also some information on transitioning from middle school into high school, from high school into college, and then once you leave college and are off in the workplace, what transitioning into those different environments may look like for you. Another topic, social relationships, stress management, and we've also thrown in there some frequently asked questions and answers on what we recommend you do. Within this toolkit, there's also a removable medical information card that you can carry around as a young adult. This has some information about what Tourette syndrome is and what some of the symptoms may look like. So you are more than welcome to make a copy of this little card, create your own. You can pass it out when you're traveling, or if you're in a new class in college, hand it out to your classmates. And it's great to have this when you go into the workplace so that you can share it amongst your colleagues. We are looking to engage this age group more specifically, and we would love to hear from you if you have some other topics that you are interested in, whether they are in webinar form or a Facebook Live. We would like to hear from you. So if you're a young adult out there, or if you're a parent of a young adult who has come across a certain situation that you do not see listed here, please feel free to reach out to us, and we would be happy to see what we can do to accommodate you. So in addition to our printed materials, as I mentioned earlier, all of the toolkits that I just went through are in print here at our office and in our warehouse. So if you are in need of them, whether to share with your child's classroom, share with your provider, share with other support staff for your child or young adults, we are more than happy to send you some. There will be an email address at the end of this presentation that you can reach out to, and we can mail some to you. If you visit tourette.org, which is our website, all of these are also in PDF form, easily accessible to you. So in addition to these, we also have some other resources that may be helpful for you as an educator, provider, or a parent of a child or young adult with Tourette syndrome. So for educators, we have a DVD of TS in the classroom. This is great to watch as an educator to see how you can be supportive to somebody in your class that has Tourette syndrome. We have a DVD that we collaborated with HBO many years ago. I have Tourette's, but Tourette's doesn't have me. This is an excellent documentary featuring children who have Tourette syndrome, and they talk about their daily life and how life with Tourette syndrome is. You'll also see here that I listed it under for parents and children. This is great for them as well. So it's great for educators to show in a classroom, but it's also great for a parent to sit down with their child and watch too. We also have flash drives with many resources in addition to the ones that I've already listed for educators. For providers, we have a nice DVD on newly diagnosed. So if you're interested in hearing more about what that looks like, we have that available to mail that out to you. And we also have a CBIT presentation DVD. This is a demonstration DVD, and this is only for providers really who are interested in learning more about getting certified in CBIT or providing this treatment to their patient. And in addition to the DVD for the HBO DVD for parents and children, we also have plastic cards that I mentioned before that are in the young adult toolkit, but they just list what Tourette syndrome is, and they're great to carry around to share with people that may be around you in certain settings. We also have coprolalia cards, and this kind of describes what coprolalia is, and in case your child does have this, they can share out that card with people around them to let them know more about Tourette syndrome. So in addition to all these great educational resources, we have some other types of resources for you. As many of you may know, if you tune into our monthly webinars, every grant year, starting in September up until August, we try and do about 8 webinars per grant year. We really try and focus on partnering with external organizations. We've done one with the American Foundation for Suicide Prevention. This past year, a couple months ago, we partnered with PACER, the National Bullying Prevention Center, to do a webinar. We also recently, in May, did a webinar with Driver Rehabilitation Institute on teen driving and Tourette syndrome, and both as a young adult and a parent, when your child with Tourette syndrome is getting ready to drive, what tips and tricks they have for you and what that may look like. So in addition to those I just mentioned, this past year we've done webinars on tic management and lifestyle, understanding and treating anxiety and depression in Tourette and tic disorder, and we did one solely on CBIT so that people can learn a little bit more about that. So every year we also do a poll to see what our constituents are most interested in learning about for this year. I know something on there this year was Tourette rage. We've gotten a lot of other great topics that we're trying to get to this year. If not, for sure, starting in September, we have a whole new series coming up. So we're always looking for more topics that you guys are interested in. So please always reach out to us, and share your thoughts with us. So as I mentioned just a few slides ago, this presentation will be posted on our YouTube channel. All of these webinars that you see here, these are all links to our YouTube channel where our webinars sit after they've been recorded. Just a brief mention, stay tuned for our upcoming webinar in August. We are very excited about this one. It's a little bit of a different style, so stay tuned in the next couple weeks and you'll see one that is coming up. So in addition to our YouTube channel webinars, we also have many other resources that we've produced over the last few years through the CDC funding. We have featured both parents and families and children who have Tourette syndrome, and we've also featured practitioners and a lot of the doctors that we work with on a regular basis who treat both children and adults with Tourette syndrome. The videos are related to different education topics, treatment options, and many co-occurring conditions that go along with Tourette syndrome. So in addition to the video resources here, how to organize a binder for school-related meetings, tips on Tourette in the workplace. This is great if you're a young adult going into the workplace for the first time, or even if you're currently in the workplace and you have had Tourette syndrome for a while now, it's great to hear some tips of how to disclose your Tourette syndrome, or just even some small accommodations that your workplace can do for you. Here's Dr. Kaufman did a video for us on planning for a successful doctor's visit and some tips that he has for you when visiting your doctor for the first time, or if you're meeting a new doctor. Jack Carney actually did this video for us, how to prepare for a successful school year and what that might look like. Him and his mom are featured, and it's a great resource to show your child. We also have a Tourette conversation series, and this is a group of videos that feature members of the Tourette syndrome community sharing their stories. So check out our YouTube channel. The link is on here at the end. We have a slew of resources. If there's something that is missing from there, please let us know, and we can always look into creating more. So another video type resource we have available through this program is Facebook Lives. These videos are hosted live on our Tourette Association Facebook page. We also we usually give a few weeks notice that this is going to be happening. Some topics have included accommodations in the education setting. Again, we partnered with bullying to not only do the webinar, but Julie Herzog did a Facebook Live on bullying and what that looks like and how to prevent it, the power of cognition, some more information on transitioning from school to the workplace, and ADHD and Tourette syndrome. All these videos can be found on the TAA Facebook page. They are recorded and you can view them after they go live. So we want to let you also know to stay tuned for the July Facebook Live coming up in just a few weeks on disclosure from presenters at our pilot Youth Ambassador Rising Leaders training. We're very excited about this, and more information is soon to follow. So I wanted to share with you a little information about our online support groups. This is another great resource that we have for parents of children specifically in areas without access to a chapter or support group or center of excellence. We're currently running 2 parent groups with about 13 parents in each group. They meet once a month for 12 months, and some topics include coping with co-occurring conditions, study and time management skills, making friends, and encouraging independence as a parent. There are many parents currently on our waiting list. We start advertising this, and if we are able to do more again, you'll hear more about this in September. And we're going to be offering hopefully more than just 2 groups so we can accommodate more parents, because we know many out there do not have access to our wonderful chapters and support groups or centers of excellence. So this is only our 2nd year doing it. However, last year, all parents reported gaining a deeper understanding of the condition and how to manage the symptoms, which was wonderful to hear. Last year, we did offer a group for young adults. However, the interest was pretty low this year, so we went with 2 parent groups since the interest was much higher, and we are hoping to possibly offer a young adult group down the line, since that is a group we know that more programming needs to be available for. So I wanted to give you guys more information about what our in-person programs look like and what the bulk of our funding goes towards. So our 4 main tracks are education, medical, CBIT, and family and community. So these education in-person programs are specifically focused for elementary, middle and high school staff, which is including but not limited to educators, administrators, school nurses, and special education staff. This year, we did over 20 programs on this track. Typically, we do 10. However, the need was very high this year, so we were able to do a few more, as well as provide virtual trainings for educators in schools. We do medical presentations, which are mostly grand rounds, focusing on the diagnosis and treatment of Tourette syndrome. Some of the groups that we were able to get to this year were in pediatrics, psychiatry, neurology, and specifically family medicine. So these are brief 1-hour lectures on what Tourette syndrome is, and this is for specifically just for providers. The next program, and our next track, I should say, is CBIT. So that focuses on the comprehensive behavioral intervention for tics. And that is a 4-hour introductory workshop covering the basics of CBIT and how it is used in practice. The workshops benefit practitioners with behavioral and clinical experience, physicians, psychologists, and other allied health professionals. As I mentioned, we were able to do about 10 medical programs and 13 CBIT programs because the need has been so high. I do also want to mention the funding provided by the CDCs allows us to do these programs for free for people. So you'll see Chelsea, Natalie, or I out traveling across the United States, helping our doctors provide these programs for our community so that more people are on the ground, spreading awareness about Tourette syndrome and learning more about how to treat it, of course. And our family and community track, that is for general families and communities out there that would just like more information about Tourette syndrome. As an example, we could go to like a law enforcement facility, teach them about what Tourette syndrome is. A lot of our centers of excellence and chapters provide family and community days where their constituents can come and learn more about Tourette syndrome. I do want to mention also that these in-person programs can be requested for groups of educators and other professionals if you email programs@tourette.org. That email is listed at the end of this presentation as well. If you know anyone that is in need or would like a type of presentation like this, you are more than welcome to reach out to us. Okay, and lastly, this is the last large program that I wanted to talk about today, and one of the resources we have for our young people in the Tourette community, our Youth Ambassador program. It is fairly well known. It's been going on for many years. Every year we have two trainings. One is in Washington, D.C. in March, and it's paired with Advocacy Day, where our young adults and members and previously trained young adults go to Capitol Hill and talk to the legislature about Tourette syndrome and things like that. And the program that the CDC directly funds is the regional training, which is coming up in July in Orlando. So this year we have about 21 youth ambassadors registered for this July training, and they will be trained to go out into their community, advocate for themselves, and teach people about Tourette syndrome. Also very exciting, we have a new pilot program, as I briefly mentioned earlier, the Youth Ambassador Rising Leaders Training, which is in conjunction with the regional YA training, also in July in Orlando. So this is for senior YAs, as we call them, and young adults ages 18 to 25 to come and meet other young adults with Tourette syndrome, enrich their knowledge and give them a renewed sense of empowerment and community connection, specifically to the Tourette syndrome community. And we will be covering topics such as stress management, disclosure, transitioning into adulthood, social relationships, and many more. We currently have 24 rising leaders joining us for this training, and we are very excited to kick this program off and are hoping with our continued funding that we're able to offer this again next summer to more young adults. So I put this slide on here if you guys want to follow us on social media, whether it's via Facebook to check out our Facebook Lives, Instagram, where we post a lot of the programs and upcoming things that we have going on, Twitter, YouTube, as I mentioned multiple times, all our videos are hosted there, all our previously recorded webinars are on there. And then if you are a LinkedIn person, our information is also on there for you to check out what events we have coming up and things like that. So at this time, we have plenty of time for questions. So I will check to see what questions I may have missed in the beginning. I know there was a little snafu with my slides. I hope everyone is able to see them now, but please take this time to ask me any questions you may have about the resources that I've mentioned. So if anyone doesn't have any questions, I will close it out, but I'll save a few more minutes. If anyone has any specific questions, feel free to ask me about these specific resources that I've mentioned, how maybe you could access them. As I mentioned, the slides will be available on our YouTube channel. And then if you email webinars@tourette.org, then I am happy to email them to you directly. My email address is on the slide where I introduced the CDC team, but if anyone wants to write this down, it is angela.sullivan@tourette.org. And you can also email webinars@tourette.org for any questions that you may have following. If you would like any of the toolkits mailed to you, please email webinars@tourette.org or my email, and I am happy to mail some out to you. If you want to let me know which toolkits specifically you would like, that will be much more helpful, just so I can give you the appropriate resources for you and your family. Okay, well, if no one has any other questions, please feel free to think about it and reach out to me after if you would like. I did want to also let you know that once the webinar is closed out, you will receive a survey on the presentation, and we would really appreciate it if you would complete that and provide your feedback. You will also receive a follow-up email within 24 to 48 hours with a link to view the recording of tonight's this afternoon's webinar. And as I mentioned, it will be posted on the Tourette Association of America's YouTube channel for those who are unable to participate today. We encourage you to reach out to us on our social media platforms, as I mentioned before, regarding this webinar or for any other ideas and suggestions you may have. So on behalf of the Tourette Association, thank you again for joining us and taking the time to view our presentation. Have a great evening, everyone.